Hello, today we're back with Jessica. She's going to be our model for me to explain muscle energy techniques. Muscle energy is a soft tissue mobilization where we use the the contraction of the muscles to put the dysfunction into a neutral position, a correct position. I like this technique because it allows the body to self-mobilize itself. I just, as a therapist, put the patient in a position where it's a direct treatment, so I put the position in a position where they are stuck, and by asking them a contraction, an isometric contraction, it allows the tissues, the patient to do its opening. So if it's stuck closed, it will put it in a position where it will open up. And that way, when the patient does their own mobilization, that has a memory. So the body remembers how it got there and how it corrected itself. So when she goes to pick up something from up here or from the floor, her body will say, that's how I used to put myself to correct. And the same if you have something going on the lumbar spine, if you go in and out of the of a car, then the body again says, that's the way I was mobilized. And when she has a dysfunction, the body will remember how to correct itself in other circumstances. So to go over type Fryet's law, there's type 1 lesions and there's type 2 lesions. Type 1 lesions are found in neutral, with no side bend, no flexion or extension. Usually it's a compensatory lesion. There's going to be 2 or 3 more than 2 vertebrae that are rotated to one side, and the law says that if there is a rotation to one side bending will be to the opposite side. Okay? And with a type 2 lesion, it's going to be more traumatic, coming from a trauma, more an acute. It will be that with flexion or with extension, side bending is going to go to the same side. So the transverse process, can you put your hands like this? So if we're going to use her, if this would be her spinous process and this would be her transverse process, when I do a side bending, automatically there's going to be a rotation to the opposite side. Okay? So if I would side bend her to one side, she automatically would rotate to the opposite side. If in flexion, if this again